Today I'm going to demonstrate a low back pain treatment, but in side-lying position. A lot of times people with low back pain are in so much pain that it's very difficult to lay on your stomach or face down because the paraspinal muscles get really tight. It also changes the angle of the low back, and when you're face down, it increases that lordosis, that lower back curve. So side lying, I use it a lot, just not for treating hip pain, bursitis, sciatica, but also low back pain quite frequently. You can see here that the patient is in side lying with the front leg or the top leg bent forward on a pillow, and the rear leg or the lower leg is straight. This is a preferable way to treat, but you know what, also to sleep as well. A lot of people who like to side sleep on their side with a pillow between the knees, and it's not as stable as this. This position allows the patient to roll a little bit forward on the ASIS and not put so much pressure on the hip itself. And sometimes with the pillow between the legs, there's a lot of wobbliness that happens. In this position, everything's very stable. So we'll be focusing on a full treatment. There's also some TMJ, some thumb problem, and some knee problem in the Japanese style. I always do a full body, but for the sake of the video, we'll target the low back here as well. Most of the issue with the low back is obviously coming from L1 to L5, the 5 lumbar vertebrae. Typically it's L4, L5, so I'll always check some of this, pain and tightness in there. There's usually always a very sore spot here on the very side of the low back, which this point is an extra point Yaoyan in the vicinity of bladder 52. This is a very key point to treat the low back. And as you can see, these needles are Japanese style needles, very, very thin. You can barely see them. They're hair-like, and they tend to not have to go in very far. Still a common misconception with people who want to get acupuncture done, that the needles are big like hypodermic needles. They're definitely not. They're very thin and really tend not to go in very far at all. This point here, bladder 23, targets the L2 area and the tightness that I felt. It's also very good to boost what we call the kidney energy or the adrenal energy. And most people in chronic pain also have chronic fatigue to some extent. Doing a point bladder 25 on both sides of the spine. This will target the stiffness and tightness at L4, and then we'll go closer into the spine, but still nowhere near the spine, and treating what's called the Huatuo line, which gets to those tight paraspinal muscles on either side of the vertebrae. And then there's some narrowing I can feel here at L4. This is a point called do 3. What the acupuncture is going to do is it simultaneously relaxes tight muscles. The needle's going into those tight fibers and letting the fibers relax. It's bringing new blood and oxygen to tight areas. When we can make more space by relaxing the tight muscles and we get new blood and oxygen to the area, we're actually getting nourishment to the discs that might be bulging or shrinking. We're creating more space, so even when there's bulging discs impinging a nerve, sometimes the nerve retracts as well. We usually let the patient lay about 20 minutes like this, and then I'll also do some more needles treating the thumb, the TMJ, and the legs, but it gives you an idea of what a side-lying position might look like with the gentle Japanese style acupuncture for low back pain. Thank you so much for watching. Please like and subscribe.